A situation has come up on one of your interpreting assignments. You're not sure if you handled it in the right way, and you're not too thrilled at the prospect of facing this situation again next week. If you are working in a private practice alone, you may wonder where you can get the needed support, feedback, and advice to do your job well. One thing is certain: if you don't seek help, you risk sacrificing the quality of the interpreting with possible damaging results. But what about consultation as a tool for providing quality service? For some interpreters, the idea of sitting down with another professional to consult about a case is nice in theory, but scarce in practice. Trust issues and concerns about confidentiality sometimes arise. Let's consider some models of how other professional fields use consultation and how these models may be applied to our work. Consultation in psychotherapy. The professional codes of ethics for social workers and psychologists require that they seek consultation when faced with an issue that goes beyond their area of training and expertise. A therapist who rarely or never seeks consultation would be viewed as unethical. To meet their need for professional consultation, therapists may have a variety of arrangements. Some belong to a group of peers who meet regularly to discuss cases. Other therapists have an ongoing arrangement with a fellow professional with whom they consult. And others make use of cross-disciplinary consultation as needed. Therapists who work for an agency may have consultation from a supervising therapist or other coworkers. Consultation may be a one-way process. The therapist seeks support, feedback, and advice from another professional without being expected to return it, or more reciprocal. In some cases, therapists will pay other professionals for consultation, but usually, amongst peers, the consultation is provided free of charge. The view is that everyone needs consultation, so requests are welcome and expected. Since therapists are also bound by the Code of Ethics to protect client confidentiality, what guidelines do they use in discussing cases? A lot depends on the kind of consultation they are seeking. Supervising consultant model. For therapists who work in an agency, they may have a supervisor who is an experienced therapist. Especially with newer therapists, arrangements may be made to meet with their supervisor on a weekly or bi-weekly basis to discuss specific cases. Usually, even such information as the client's name and details of his or her issues will be shared. The supervisor may regularly review the therapist's progress notes. Since they are working in the same agency, the cloak of confidentiality extends to the supervisor, and there is no need to request permission from the client to release this information to the supervisor. So, basically, The therapist discusses the case openly with the supervisor to provide ethical quality service.